Good morning. My name is Janet Thurston, and today I will present this podcast on the topic of my investigation of online resources related to health literacy in population health. My topic will provide inquiry into the health topic of obesity relating to the population of Montana residents. I will explore what information is available regarding this topic, how to access and examine its health literacy functionality for patient education. The literature regarding obesity in the United States marks an increase that is occurring. There are many factors that contribute to this. Lack of activity and lifestyle issues are the growing concern nationwide. More than 35% of men and women are considered obese, and 16.9% of children and adolescents are also considered obese. The population of interest is the population of Montana, adults who are obese. This has been considered an epidemic in the United States, causing many problems, and although Montana does not have the highest incidence, it is very prevalent and is a concern, just as it is in the general population, from childhood to adult age. The importance to the author is that obesity is a growing problem with many comorbidities. The investigation in health literacy is needed on this topic and is very relevant to healthcare diversity in Montana. Obesity in the United States is considered to be a trend that is growing, and if the trends continue, in only 15 years, 80% of all American adults will be overweight or obese. And that means that if these risks rise as reported, the overall costs in healthcare due to the comorbidities are considerable. What do Montana residents believe about obesity? It is rarely brought into discussion. The risk of increasing cardiovascular risks are rising in the native population in Montana, which this graph represents. There are no programs improving these statistics. Is it due to health literacy? That relationship has not been investigated. Between 1999 and 2003, 1,000 American Indians, adults over the age of 18, living on or near 7 reservations in Montana were interviewed each year using an adapted behavior risk factor surveillance system survey, and a rise in health problems were noted over this time as follows. The diabetes rates increased from 12% to 16%. High blood pressure rose from 26 to 34%. Cholesterol rates rose from 23 to 30%, and obesity increased from 34 to 39%. The percentage reported current smoking was stable and remained high, 38 to 36%. This is according to the Robert Woods Johnson Foundation report in 2014 on obesity. Montana ranked 45th among all 51 states and territories regarding obesity. However, the percentage rates of the population continue to climb, aligning with the rest of the country. The rate of obesity in Montana is below again national averages, yet still remains high as 25% of all in the overall population. The obesity rates of male to female are 25 to 23%, and the rates according to age are as listed. From age 18 to 25, 14.2% are listed as obese. Between ages 26 to 44, 24.9% are listed. From age 45 to 64, 29.4%. And then 65 and above is 22.6% of the population noting obesity. The comorbidities listed begin in childhood and continue into adulthood. They include hypertension, dyslipidemia, fatty liver disease, diabetes, polycystic ovarian syndrome, sleep apnea, and psychosocial problems. To investigate online education, We begin by examining educational levels and literacy levels of Montana residents, which are consistent with national averages. 38% of residents have some college education in Montana. 91% have basic literacy skills. That is encouraging when considering health literacy skills. Health literacy in the USA is 36%, so this topic is important to investigate when examining patient healthcare education. Health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Limited health literacy affects people of all ages, races, incomes, and education levels, but the impact of limited health literacy affects lower socioeconomic and minority groups. It affects people's ability to search for and use health information, to adopt healthy life behaviors, and act on important public health alerts. Limited health literacy is also associated with worse health outcomes and higher costs of health care. When we examine the adult populations of Montana, there is diversity. There are large native communities with high rates of diabetes and the other cardiovascular comorbidities reviewed. There's also a large Hutterite population with 50 colonies located all around the state. They speak primarily German languages and are known to have higher cardiovascular disorders. Other considerations of cultural factors relate to obesity, health risks that rural residents experience, such as cardiovascular events, stroke, and diabetes. They may be living many miles from healthcare providers or have access to health hospitals. 44% of the population lives in rural regions, while 55% of our population in Montana live in urban regions. Provider education and screening is best when geared toward promoting healthy lifestyles rather than creating self-care difficulties. Theoretical harms may occur from overweight labeling that induces ineffective self-care concerns. The needs of population health involve screening that is according to standards of practice, also receiving risk reduction health education, and promoting healthy lifestyles. Our patients also need information regarding effective intervention options that are evidence-based and acceptable to the client culture and family. Providing information that can be understood is necessary, and health literacy is necessary. To consider the learners is to know the literature reviewed regarding Montana residents. They are rural, urban, diverse, and complex. What do they need? Health information that is effective, culturally appropriate, understood, accessible, and affordable. Regarding obesity, do they know their weight status or the risks? Do they know how to set goals and achieve them? Is there any motivation or barriers to address this as diagnosis? That is a good question for each provider to ask themselves in practice to investigate implementation of interventions. Examining online resources available for your population of patients may be very helpful to achieve an improved outcome of care. Do Montana residents have access to online materials? The answer is yes, they do. According to the literature available through census data, 73% of Montana residents accessed the internet in 2010. The next question is online health education material available and understood by most readers? For more information on access to computers and experience online, see the website posted in the PowerPoint presentation. EditCentral.com is a website to use to examine health literacy and investigate or analyze the readability of health education materials. They provide many tools for this. The complexity of information on the web is prevalent. Usability of the web and the websites can be examined by analyzing the information of readability. There are three methods commonly used which are listed on this slide: the Flesch score, the ARI, or Automated Readable Index, and the SMOG index, which is also the Simple Measures of Gobbledygook. These will be used to measure readability for health literacy. For most of the population, anything above the 8th grade level is difficult to read, especially when it includes medical jargon. The 5th to 6th grade reading level can be understood by the majority of those who use healthcare systems and is recommended for all health education materials. As you can see, the Flesch score examines the grade level of the reader, as does the ARI measurement and the SMOG measurement. By performing a Google search, the Mayo Clinic website was noted to be the most frequently visited site related to health information on obesity. The Mayo Clinic itself has extensive information on patient education. It is up-to-date, reliable, and accurate. My analysis came to these conclusions. Do the materials meet the population's need? The information on the site is extensive on the topic, with complex information presented in English language. It is also available in Spanish, Portuguese, Arabic, and Mandarin. The difficulty is the majority of site visitors may not be aware of this translation because it is located at the top right hand of the page in a very minimal size, difficult to find for the author. The design of the website is based on the Mayo design of its education materials and its website historically. There are advertisements that are distracting on the page. However, there are also valuable links to the clinic to make appointments, for example. There are sites recruiting subjects for clinical studies. There are also links to interactive tools such as the BMI calculator and other materials related to obesity management. There are links to many items related to obesity for purchase as advertisement for book, DVD, or other items related to obesity created by the Mayo Clinic. It is up-to-date, factual, just as the organization itself. The intended audiences are patients, families, providers, individuals who are searching for information on any topic. It is moderately easy to navigate. Because there's so much information on the site, it is easy to miss small links, which may not be a priority, such as translators. To evaluate and redesign this Mayo Clinic website, I will be utilizing the U.S. Department of Health and Human Services Office of Disease Prevention and Health Promotion research-based recommendations for redesign of websites. They recommend that web designers incorporate health literacy into the educational site. These are my recommendations to consider for redesign and update of this website. About users and their goals. The learners may be adult age and need functional information. Regarding writing actionable content, this site is in need of behavior content that does not need to be purchased, such as purchasing exercise DVDs. The advertisement on the site is a negative impact. They should be displaying content clearly on the page. The content is disorganized, it is distracted with advertisement and clinical research engagement. However, being able to access clinical appointments segments may be beneficial. To organize the content and simplify navigation would be very helpful. This site has excellent extensive information. However, it is difficult to navigate. For example, finding the translator location. To engage users with interactive content would be beneficial. There are many links. However, online lectures rather than purchasing a DVD would improve this site. The second most frequently visited site was the National Library of Medicine PubMed Health website. This page is similar to a literary paper written simply. It has just a few photographs for visual aid, and it is updated frequently with accurate information and references. There are links to other sites, and while it is visually unappealing, it has links and references to evidence-based information and interventions to address obesity for the reader.